Hi, my name is Karen. This is my husband, Terry. I want to tell you a little bit about my experience with lipedema. I never knew what lipedema was. I always knew I used to have a small upper body and a very large lower body since I was about 11 years old. Never knew what it was until about a year and a half ago. Was at a party and a woman was talking about her husband having two different size shoes and how she had to go, and somebody told her to go to a particular massage therapist, and she did, and she said after the first massage his feet were the same size. So when we got in the car, Terry said, well, why don't you go see her? And I said, well, my feet are the same size, why would I go see her? It's because your ankles are always swollen. So I went to see her. The third visit, I asked if Terry could go with me, and he did. And she looked at him and she said, Dr. Moore, do you think that Karen has lipedema? That was the first I had ever heard the term.
That was the first I had ever heard the term, too.
So we got home and we looked on the internet to see what we could find. I got onto the Lipedema Sisters, I think I'm on 3 different Lipedema Sisters sites. Got a lot of information. I went to see Dr. Karen Herbst, and she said that I was ready for surgery.
And she diagnosed you.
She diagnosed me and said I was ready for surgery. And she recommended Dr. Amron and 2 other doctors and said, you go ahead and check them out and see what you think. So that's what we did. We decided on Dr. Amron. Love the fact that he does circumferential surgery, and I kept looking online to see who all these other gals were going to and who they recommended, and it was Dr. Amron more than anybody else. And so we looked him up, looked up his history, and were very impressed. So a year ago, I could walk for about 200 feet, and then I had severe pain from my hip down to about my knees. And I just couldn't walk any further. So in July last year, we bought a wheelchair that I would use if we were going to be going very far. So when I had my thighs done on Thursday, I guess it was Friday, we went out for a couple of walks, and I walked a mile. And I was just amazed. How could I do this? I had no pain. And the next day we did 1.5 miles, and Saturday we did 2 miles, and Sunday we did 2 miles. I was feeling terrific. It was great. Then yesterday I had surgery on my calves and my upper arms. And that was a little bit harder. My calves really hurt. And I went home and I took some hydrocodone and I slept. And this morning I feel a lot better. I'm still getting around. I used to have cramps in my legs, anywhere from my feet all the way up my thighs. Very bad cramps. And I would have to stretch them out at night and put my feet on a vibrator. And that would help some, but not totally. Well, since I had the thigh surgery, I have not had any cramps in my legs. I am so excited. My life is changing. I do not have to use a wheelchair anymore. I feel better about myself, and it's really exciting. Here I met Christina. I talked with her first. She's been very, very helpful, very kind. We communicated a lot through email. And the other staff members who I thought were very special were 2 of the Lisas. They were both in surgery, and Kelly was in surgery, and Evelyn has been very helpful. Dr. Amron is fantastic. He is very caring. He was very gentle with me. He was paying attention to my pain during surgery and trying to make things as easy as he could. He's also got this wonderful staff, and they all have caring hearts and gentle hands, and I really appreciate that. I had a lot of trouble with my left knee, and it's been going on for a good while now. And I figured I was going to have to be having knee surgery at some point. But I read on one of the Lipedema sister sites that Dr. Amron's office was doing something with stem cell therapy. So I asked my husband, what is this? Is this something that might help me? And he said, yeah, let's ask about it when we get there. So we came in for my surgery, my first surgery on Thursday, met Dr. Price, who does the stem cell surgery, and they were able to set it up, and when I had the fat taken out of my thighs, and he injected it right after my surgery was done. And I have had no problems with my knees since. So it's been wonderful. Now we're talking to Terry's dad, and we're hoping, he has very bad knees. Of course, he's 90-something, 91. He's got very bad knees. He also has COPD. And we understand from Lindsay, Dr. Price's gal, that that can also be helped with this. So we're trying to talk Terry's dad into coming out to have surgery too.
We weren't taught anything about lipedema in medical school or residency, and really haven't seen much at all in the medical literature about it. We were taught about lipodystrophies, and there's a number of those. Most of them don't have any specific treatment, and so most of us just ignored them and gave advice, like you've heard, of exercise and diet to treat overweight people. When we started investigating lipedema last year, it really opened my eyes. I knew that Karen was having trouble, and it was really difficult to see her mobility decrease the way it did. I really pushed for getting the electric wheelchair so that she could go places and not be limited by how far she could walk. And we've used it quite a bit in the last 10 months since we've had it. But the idea of having a surgery that would take that pain away and give her mobility again was very appealing to me. So I'm really pleased that we were able to find this opportunity. As far as the stem cells, of course, stem cells are a lot more mainstream than lipedema surgery. And in my practice, about the only people that have gotten it are bone marrow transplants for leukemia and cancer. And I've had several of those patients through the years. But the opportunities that stem cells open are just wonderful. I am interested in getting my dad treated his lung disease with infusions of his own stem cells and his knees as well. I think that it would really change his life and ability to do things if we were able to do that. So it's really exciting to see the progress that's being made in stem cell research.
You know what else is very helpful? Having a husband there with you the whole time. Encouraging and helping.